It has now been 7 months since I have been diagnosed with ALS and 15 months since I started having symptoms. Every 2 months, I go to the University of Colorado to see my care team, and my care team includes my neurologist, speech therapist, physical therapist, occupational therapist, ALS United, dietitian, speech language pathologist, social worker, and mental health profession. I'm really having troubles gripping things and like using pumps or lotions, utensils, washing my hair. I can't shave my legs anymore.
Yeah.
My right hand is constantly closing.
Okay.
I try to keep it open. It starts to get kind of shaky.
Okay.
Getting in and out of the car, getting my seatbelt on, my daughters anybody has to help me with that. Getting comfortable in bed has just really been a nightmare. It's really getting difficult for me to walk short distances even in my house. Excuse me, it's one level. But I could be standing there and feel like I've almost tipped over a couple times. I'm really unsteady on my feet and losing my balance.
Mm-hmm.
But I've noticed my laugh and my cough are different.
Okay.
I've been told by a few of the doctors that they really think that hopefully my breathing is the last thing to go. But listening to myself in videos and coughing, I know that it's weaker.
Okay.
But my laugh is different.
Okay.
Is that
not uncommon?
okay?
I was gonna say.
I just can't bend my legs anymore at all. Just trying to get into bed and to get my legs up. It's just they're so stiff. My thighs
Okay.
are so stiff.
Okay.
So getting up is yeah. Normally I hold on to somebody or something, but
Go ahead and have a seat.
and lifting my legs is not really doable. It's a lot of
Yeah.
picking them up.
How's your fatigue?
Tired.
Yeah. I think I'm gonna say something that you're not really gonna be pleased me to say. I think you need to use this in the house. And I think you shouldn't really necessarily be furniture walking. And a couple reasons for that. One, with how you're walking, and I'm not gonna tell you anything you don't already know, you're a pretty high fall risk.
Yeah.
Right, and I don't want you to fall. I know you don't want to fall. Nobody wants you to fall. Two, walking is a very interesting phenomenon that when you walk without kind of the proper mechanics, it actually takes more energy, right? We're kind of evolved or made to walk how we walk when we don't have weakness. And when we develop weakness like now with you, it's actually takes more energy, right? Because you have a weaker muscle to do the thing. And so what the body does, it's nothing you're doing on purpose, it's just what the body does. It finds a way to get you moving forward. And that way to get you moving forward just takes more energy.
Isn't it gonna make it so where I lose my ability to walk faster? I guess it's kind of.
No, not necessarily. You can still walk some, but park this thing closer to the door, walk to it. You know what I mean? Like getting out of bed, walking to it, things like that. It's a very good question. The unfortunate thing about this disease is you're going to lose your ability to walk anyway, right? Like it really makes me sad to say that out loud.
I know.
And the balance that is more important is you walking in your house very slowly, using the furniture, a good use of the energy, or would you rather save that energy by using the chair and using that energy for something you want to do, like hanging out with your family?
For me?
I can't.
Okay, that's okay. What about this end?
That's about it.
Okay, good. You relax it, you let me move you around, okay?
Okay. Yeah, I mean, the appetite, my appetite, it like comes and goes. Some days but I wonder if that's part of the depression or.
It can be a factor.
Because I think I've gained a couple of pounds since the last time I've been here.
Yeah,
but
let me go.
Okay, so I'm gonna ask you a bunch of questions, like kind of.
This is the lightning round?
Yes,
Okay,
but I
cool.
wanted to let you know before, that I did request physical therapy and occupational therapy.
Mhm.
So they're starting next week at my house.
Perfect, okay.
So that'll be nice.
Okay. And I'm ready whenever you are.
Okay,
It's
so-
just, this is me just for later when I
Some
pretend to write my notes.
Some things that I've been asked, there's
Okay.
some questions that I've been asked.
Mhm.
What is lipoic acid?
Oh, alpha lipoic acid?
Sure.
Yeah. So alpha lipoic acid is an over-the-counter supplement that, and is that what it? Yeah, I'm assuming this is what they're talking about. It's an over-the-counter supplement, and the idea being that it just creates a healthier environment for the nerve. I have a lot of patients with neuropathy take it. Most common side effect of it is some GI upset, but I was gonna say, it's one of those, how much benefit it gives, questionable, but I know, especially patients with neuropathy will take it. I don't know, we'd have to check ALS Untangled. Have you seen that website?
Calcium EAP injections.
That I'm not familiar with.
B12 injections.
Yeah, so the B12, there actually is evidence about that, that really high volumes of B12. We actually, we are recommending higher doses of B12 orally, or a compounding pharmacy will do B12 injections. We have a few patients. There's some evidence of slowing progression. There's been a few papers out.
Tofersen. Yeah.
So tofersen is an FDA-approved medication, but it is specifically for patients with SOD1 mutation. So because you're negative, you wouldn't qualify. So it's
why I haven't had a MRI on my brain, which I was really curious about, because what if there was something else going on?
Yeah, I think again, I'm happy to order it. I think based on the EMG and the lab, like based on your workup thus far, and the way that it's progressing over time.
Okay.
Like I said, I'm happy to order it. I just,
I get asked some of these things, and I'm like, wait a minute.
Yeah.
Like what? And
Yeah.
so I just want to
Yeah.
ask so you can explain it to me a little bit better, and that does make sense. So okay. It's progressing fast because it seems like I was just here, 2 months ago,
Mhm.
and now I'm barely walking.
Yeah.
My hands. It's hard to explain to people, but I can't even type anymore. I can't really write anymore. My hands will just start to go like this, and I just can't move them.
Yeah.
I can still move them, but
Right.
I just feel like everything just seems to be changing so fast, and it just doesn't.
I know, and it's hard because ALS is it's a very heterogeneous. It's a spectrum, right? There's some people that we think are more slow progressing, some people are faster. So it is hard to predict when we first might meet you. As far as giving you a timeline, we have to kind of see data points over time. I don't think this is like outside the realm of.
Voice banking?
Mhm.
Should I be starting that now?
I think it doesn't hurt. Now we have some patients that their like voice is never really impacted. But I think I'd rather have it and not need it than.
Dr. Foster talked about microdosing with mushrooms.
Mhm.
What would be the benefits of that?
I wonder what she was. I know they're doing some of it with like depression, anxiety. I think John's. Okay, I was gonna say for mood. I think it's Johns Hopkins was doing a study that was looking at that.
Okay.
I don't know that we I don't know what we have available here. I don't think anything specific for ALS.
Dr. Foster was the one that brought it up.
Okay.
So I thought, oh wow, okay, well.
Yeah, I can double check with her.
I said I wasn't interested in something like that, but I was just kind of curious if it was more for mood, if there was any other benefits to it, but for sure.
Spirometry. I'll have Leah reach out about the voice banking. And then I will shoot Dr. Dunbar a message about the study that came back, the overnight oximetry, so he can take a look at that. And then, like I said, let me see if research is still available. And then I do want to get some labs on you to just be checking your liver function. And I think with you mentioning kind of some of the other stuff, I'm going to go ahead and check kidney function too. It's just a slightly different lab, but.
Okay.